have been reports of this teenage actress getting Botox injections to prep for an upcoming part on the hit show Glee. And, of course, that stirred debate and sparked outrage by parents and medical professionals. But she's apparently not alone. More teens than ever are using Botox. Dr. Michael Fiorillo is a board-certified plastic surgeon specializing in cosmetic plastic surgery. Dr. Fiorillo, thanks so much for being here.
Thanks for having me.
You've used Botox on teenagers, but you say for medical reasons. Like what?
Absolutely. It's very common, mostly for underarm sweating, mostly in teenagers and teenage girls, usually. And also you can use it for some facial asymmetries, TMJ, twitching, migraines,
but when we
stuff
talk
like
about
that.
facial asymmetries, we're talking about cosmetic reasons, right?
Well, not necessarily cosmetic, due to like a Bell's palsy or some sort of neurological deficit on one side, and you can use it on the other side for symmetry.
Okay, but when you hear that 12,000 teenagers in 2009 were given Botox, you have to assume that some of those were for cosmetic reasons. Do you know about, I mean, have you heard of doctors or even patients coming in and asking you for Botox?
Absolutely, all the time. Teenagers are asking for Botox, and I absolutely will not do it. And I recommend any plastic surgeon not to do it for cosmetic reasons.
What is a teenage girl thinking when she wants Botox? What's the rationale?
Well, she needs a psychiatrist at that point, because an 18-year-old wanting to look like a 14-year-old. I mean, it's done for wrinkle reduction, to look younger. We want to look more youthful. That's why we do it. So for an 18-year-old wanting to look more youthful, it's not indicated.
What is the risk for teenagers using Botox?
You know, there's really not a medical risk. It's a very safe drug. It's actually the most common procedure performed in the country. So there's not really a risk per se, but it simply is not indicated.
But at some point, if girls start this whole process at 16 years old, by the time they're 46, what does their face look like?
Well, that's a question and a concern. There's no studies, obviously, because we don't use it at that age. So no one really knows what will happen. I assume the muscle will atrophy. So it could be a problem later on in life.
So again, if a girl comes in, a teenager, and says, I just want to look a few years younger, what do you tell her?
I say absolutely not. It's not indicated, and I will speak to the mom if the mom is there.
Wow. Scary stuff. All right, Dr. Michael Fiorillo, thanks so much for coming in and
sharing
your experience with us.